Hello and welcome to this short video describing how to perform local anaesthetic injection prior to a procedure. This is not the only way which this can be done, however this is the way it is performed in our trust and you should follow your local guidelines. Before getting to this point, you should have already considered the following: the patient's allergy status, whether any of the bloods are out of normal parameters, whether they are on any anticoagulation, for example warfarin or the NOAC type anticoagulation medication. There are specific trust guidelines as to when to stop any form of anticoagulation before a procedure. You will require the following items. To start with, local anaesthetic, in this case 1% lidocaine, something to clean the skin with, here we're using ChloraPrep, a pair of sterile gloves, a basic pack, this will contain some swabs, a tray in which to put your used sharps temporarily before putting them in the sharps bin, and a smaller drape which you can put on the side of the patient, 10 ml syringe with which to draw the local anaesthetic into, a blunt filling needle. If you're using a glass vial to draw your anaesthetic from, you'll require a filter needle, a drape with which to cover the sterile field, an orange needle to make the first injection into the skin, a green needle to go slightly deeper to your target area. If your target area is very deep, you will require a spinal needle, a scalpel with which to make the nick in the skin to pass your instruments through. Now it's time to draw the local anaesthetic in preparation for injection. First of all, get your assistant to hold up the bottle and make sure you have the right medication, in this case 1% lidocaine in 10 ml. Always check the expiry date and read this out to your assistant. In this case it's 03/2022. While your assistant holds the local anaesthetic upside down, insert the blunt drawing needle and draw out 10 ml. Hold the needle upside down and push out any air. Some of the local anaesthetic that's in the actual needle itself will come out. Grab the needle and syringe, move the drawing needle and either put it in the tray of the basic pack or straight into the sharps bin. Then attach your orange needle, and again with the cap on just inject forward until the local anaesthetic comes through the tip of the needle. Then put it to the side until you're ready to use. For this demonstration we're using a nectarine, as it has an outer thin skin and soft tissue flesh underneath. So before you start, always make sure the area is sterile and clean and the sterile drape has not been touched. Before you start, warn the patient that you're going to start and they'll feel a sharp scratch and you'll tell them when. So hold your hand steady on the skin and then tell them sharp scratch and then inject. Hold the top of the syringe, then the bottom and keep it steady. Pull back first of all. This will make sure you're not in a blood vessel, as blood will come up through into the syringe. If this happens, withdraw the needle and push on the skin. So we'll inject just immediately underneath the skin first of all, to create a bleb. Some of the anaesthetic can come back, this is not a concern. Okay, once you're up to the depth of where you need to be with the orange needle, Every time you move forward, pull back to make sure no blood comes into the syringe. Okay, once you're up to the depth, hold the needle steady and unwind and leave the needle in place. This will make sure that you go back exactly in the same place with the green needle. So do exactly the same as you did previously with your orange needle and inject forward until some local anaesthetic comes out the front of the needle. When you're ready, take the cover off, place the needle and syringe in a safe place, remove the orange needle where you can see, so you can see exactly where you're going to re-inject, and place this straight into a sharp spin. Again, go into the exact same area and warn the patient again, sharp scratch. And as we did last time, withdraw each time before injecting forward. Make sure no blood comes up into the syringe. Okay. Once you finish this, remove everything, and if you're going to put more anaesthetic in, place it in a safe place with the sharp part of the instrument away from you. Take some swabs and gently clean over the area and clean any blood. When you've injected your local anaesthetic, take a scalpel and just with the very front of the blade, make a small nick into the skin. This will allow access for your biopsy guns and drainage introducer needle. If you do not make this incision, your biopsy needle will just keep bouncing off the skin, the same with your introducer needle, and it could slip off. This just allows very clean, easy access. And now you're ready to perform your procedure.